Hi, moving to the next video on NCLEX RN. Which statement by the nurse indicates an understanding of the benefits of interprofessional collaboration in providing care for patients with chronic illness? Select all that apply. So some statements will be given which are stated by the nurse, and you have to select which statement shows the nurse understands the benefits of interprofessional collaboration. The statements are: social worker can be consulted to assist with long-term counseling. Family members need to be included with the patient's approval to assess their willingness to assist in long-term care of the patient. Each member of the ICT participates in patient education and can use teach back as a technique to determine synthesis of the information. The ICT is concerned about developing a solid discharge plan that produces positive outcomes for the patient and prevents readmissions. Direct care nurses are not involved in long-term care planning for patients with chronic illness. So let's see the answer. Of course, social worker can be consulted to assist with long-term counseling. You need to think about who all are the members of the ICT. You know that social worker is a member and they must be consulted. Next, family members need to be included with the patient's approval. The patient has to approve the cooperation of the family member or the involvement of the family member in patient's care to assess the willingness of the patient and also of the family member to assist in long-term care of the patient. Third option also is correct. Each member of the ICT participates in patient education and they use a technique known as teach back. Teach back is something when the ICT member teaches the patient and the patient or the family member, they will return back whatever they have learned in their own language. They will express that things. So that is a teach back technique. So with that we will be able to determine how much information they have understood. And also the fourth option is correct. The ICT is concerned about developing a solid discharge plan so that positive outcomes will be obtained from the patient side and also it will prevent readmissions. You know that the readmissions for about 30 days, it should not happen. That shows that there was a problem with our quality of care. Here the fifth point is wrong. That is, here it says direct care nurses are not involved in long-term care, but direct care nurses are also involved in long-term care planning for patients with chronic illness. Thank you so much.